The mortgage is due and the car broke down. You think your child is being bullied at school. Your relationship with your significant other is rocky, and Christmas is a short 6 weeks away. Recipes for anxiety and depression. What to do? Dr. Gregory Scott Brown is a sought-after mental health writer, guest, and practicing psychiatrist. He believes in a holistic approach to mental health care. He is the author of The Self-Healing Mind. He has been featured on The Today Show, The New York Times, The Washington Post, Men's Health, CNN, NPR, and other media outlets. He has a number of tips he will share to get us through the holidays and beyond. Stay tuned.
Baransu Balance Podcast with Dr. Ince emphasizes the interdependence and importance of a healthy mind, body, and soul.
Remember, this podcast is for educational purposes only and does not substitute for professional medical advice. It is important to seek the advice of your personal doctor or healthcare provider before undertaking a new healthcare regimen. Welcome, Dr. Gregory Brown, to another episode of the Baransu Balance Podcast. It's quite a privilege to have you here. And I know that you're interviewed at CNN. I think I saw an episode with Kelly Ripa and a wonderful article in the Washington Post. So it's quite an honor.
Thank you so much for having me.
Okay. I want to start off with a quote from your book. And the book, The Self-Healing Mind. I've come to realize that mental health is the driving force behind every decision we make, how we live, work, and love. Can you expound on that statement? That's a pretty sweeping statement.
It really is. I mean, if you think about some sheer statistics here, so about 40 million Americans a year struggle with anxiety. Depression's not far behind. There are almost 140 suicides every day in the United States on average. And so when you think about how pervasive mental illness is, and how mental illness and mental health can both impact our satisfaction at work. They can definitely impact how we get along with our friends and our family. They can impact the success of our marriages. And so, again, when it comes to mental health and our overall sense of well-being, I think it's something that not only people who have been diagnosed with depression, anxiety, and other mental illnesses should pay attention to, but even people who haven't struggled with those things should also pay attention to as well.
Okay, so do you think that this is a problem that has increased in the last few decades? I had an older woman tell me, I don't remember anything about all these mental problems when I was young. It's my opinion that has always been there. We just didn't talk about it.
You and I are on the same page, Christine. I agree with you. I don't think that these problems have necessarily increased, but I think one of the things that we're noticing is that as mental illness becomes more destigmatized, as more people are talking about it, and it's becoming more okay to share stories of mental health and mental illness and recovery stories and hope narratives, then you're going to see more people coming out and actually sharing their stories as well. The other thing that you might see is that, again, as mental illness becomes less stigmatized, then patients might be more open about sharing, more intimate details about their struggles with anxiety and depression with their doctors too. So you'll see an increase in diagnoses that way.
Oh, okay. Sometimes we don't even have words to describe what we're feeling. We don't have the language, and now the language is becoming more available. So one of the goals of this podcast is to connect the two generations. My generation, a more mature one, and yours a younger one. And one of the words that the younger generation, to me, seems to throw around a lot is the word boundaries. As a mother and grandmother, I've had this word tossed around. So, and I've read a whole book about it. But can you explain what does the term boundaries mean, and how is it applicable to the average person or overzealous mother or grandmother?
Yeah, I really think of boundaries as something that is in the context of this word burnout that is too familiar to all of us. So, as many listeners may know, recently the World Health Organization added burnout as a diagnosis in the ICD 11, I
Oh,
believe.
okay.
How it's actually something that can be diagnosed. And one of the biggest reasons for burnout is because we don't know how to create boundaries. And I would say that this is something that applies across the generations. I think one of the things that we have to keep in mind, I always think of whenever we get on an airplane, right, and they're going through the safety check and they say, if there's a loss of oxygen in the cabin, make sure that you put the mask on yourself first and then you put it on your kid, right? And so we have to be able to take care of ourselves, to pay attention to our own self-care, which sometimes means saying no, right? Sometimes means, at a certain time of the day, at 5 o'clock or whatever, we're going to turn off the laptop. We're going to stop checking emails. We're going to take a half a day if we can to pay attention for our mental health so that we can be a better parent, a better spouse, and a better friend.
Okay. So in your article of the Washington Post, you use the word connections and, how important these connections are. Sometimes we have separate lives. We have the work life, home life, and for some of us, church life. In the past, it seems like it was so important to keep these lives separate. But in recent years, I've felt that I think it needs to be melded together. What do these connections, how can you prioritize these connections? And
I'll say the sense of feeling disconnected is something that's on a lot of people's minds these days, especially as we recover from the COVID pandemic, right? That was a time where social isolation and feeling lonely, feeling disconnected was something that was really on most people's minds. It really started paying attention to it. And I'll tell you, as a psychiatrist, I saw how feeling disconnected, feeling lonely would actually contribute to my patients experiencing symptoms of mental illnesses like anxiety and depression. So when I think of connection and how we might be able to establish more meaningful connection, because that's the key, meaningful connection, right? I think of either connecting, through a higher power, if we happen to be religious, connecting with our God through prayer, but that's not the only form of connection, connecting with our inner self through meditation, mindfulness, which really goes back to this idea of self-care, or even finding ways to meaningfully connect with the people around us, which may mean volunteering your time. I think of my grandmother in San Angelo, Texas, when I was growing up. Every Monday, my grandmother, didn't have a lot of money, but I go with her when I stayed with her during the summer to the soup kitchen at the local church, and she would make soup for homeless people, right? And so that's a way to establish meaningful connection as well.
Okay. So I want to move into a little bit of solutions. A lot of us like medicines as a quick fix, and psychotherapy is becoming more acceptable, expensive but acceptable. So what are some of your additional tools in your toolbox? I'm referring to your book.
And I think you make a really good point here, right? And so, I would argue that there is somewhat of a mental illness crisis in the United States and around the world, with so many suicides, as I mentioned earlier, so many people struggling with anxiety, so many people struggling with depression. And one thing I think we all need to be really mindful of, the fact that therapy is expensive. Seeing a psychiatrist like me is not necessarily something that's easy or accessible or available to a lot of people because of insurance coverage and long wait time. So, with that said, I mean, it's important that, while someone is waiting to get in, or if someone's not able to get in, that they utilize the resources in their environment, right? So the book, what I talk about are 5 essential pillars of self-care, which is not a replacement for seeing a psychiatrist or taking a medication or going to therapy, but it's a good place to start. Sleep, spirituality, nutrition, breath work, and movement. And in the book, I explain actionable strategies that anyone can take, regardless of their walk in life, to start utilizing these 5 pillars of self-care to improve their mental health.
So the breath work, can you explain a little bit about that?
So each of us takes between 20 and 30,000 breaths every single day, which is
wow.
Right. When I go to give talks, I mean, everyone gets this question wrong, right? But the thing about it is, in my view, breath work and our ability to manipulate the way that we breathe is one of the most underutilized tools for mental health at our disposal. And the thing is, if you've ever been in a situation where, and I know I definitely have, when you're anxious or you're feeling panicky or jittery, and someone around you, there's going to be an annoying person that's just like, calm down, take some deep breaths, you'll be fine.
Breath.
Right? That's probably the last thing you want to hear in that situation. So what I encourage people to do, and what I outline in the book, is to learn specific ways to manipulate your breath, even when you're not anxious, right? So one of my favorite techniques is the 4-7-8 technique that was popularized by Dr. Andrew Weil, who's an integrative psychiatrist down in Arizona. And basically what you're doing is you're inhaling for 4 seconds, 7 seconds, and then you exhale for 8 seconds. And I'll tell you, Christine, the numbers 4, 7, 8 are pretty arbitrary, right? Okay. But here's what's not arbitrary. What's been studied is that when we exhale for longer than we inhale, what we're doing is we're actually increasing parasympathetic tone, right? Meaning that we are, potentially lowering our heart rate, lowering our blood pressure, increasing
counteracting that fight or flight surge.
Right. Increasing GABA in the brain. GABA is an inhibitory neurotransmitter that just slows everything down. So it's a great way, along with other techniques I outline in the book, to induce a sense of calm and relaxation.
Okay. So you were talking about the brain. Can you tell us a little bit about that, the actual connections in the brain, the pathways, just briefly?
Right. I mean, that is a loaded question, and I'll tell you, when it comes to how self-care can affect the brain, I'll tell you there's a specific network of regions of the brain called the default mode network. Okay.
Default mode network.
Default mode network. That's right. And so the default mode network tends to be most active when we are, if we're experiencing high anxiety or stress. It tends to be most active when we're just chilling, when we're sitting on the couch, watching our Netflix show, when we're at the dinner table. If we're anxious, stressed, or burned out, there's a lot of chatter going on in the default mode network in the brain. Now, studies have shown that spiritual connections, as I mentioned earlier, whether it's if you happen to be religious through prayer or volunteering your time or meditating, can actually quiet or lessen activity in the default mode network, and that can help reduce anxiety as well.
Oh, okay. So the default mode network, what is the original purpose of this network?
Well, I mean, what I would imagine that it would all relate to. I mean, if you think about the way our bodies are designed, even something like the fight or flight response, right? That is there by evolutionary design. I mean, if you imagine back in our hunter-gatherer days, right? If we're out in the woods, looking for dinner, and a bear jumps out, right, to eat us,
okay.
attack us.
So it kind of helped us survive, but right now it's hurting us.
Right. I mean, if we are in this Zen state of meditation when there's a hungry bear next to us, I mean, we're going to get eaten, right? So when it comes to these processes, these neurobiological processes, I mean, they're there for a reason, and so we have to, I think, learn how to, when they're maybe getting out of control a little bit or preventing us from living an adaptive life, engaging with our family and friends, that's when it can become problematic.
Okay. So one of the 5 pillars was physical activity.
Yeah.
I read something about forest bathing, walking in the forest.
Tell me about forest bathing.
It has something to do with I think it's in the Japanese culture, where the walking in the woods, actually helps you regain your spiritual mental balance.
Well, I'll tell you this. I can't speak about forest bathing, but what I can say is when we move our body more, studies have shown that movement, and by movement I don't mean running a marathon or signing up for an intensive workout class. Just moving more, even that means walking to the mailbox or doing some stretches in your chair every day, some gentle yoga. So when we move our body, we're actually increasing expression of an amino acid called BDNF, brain-derived neurotrophic factor.
Oh, okay.
BDNF. And so what that does is it kind of acts like fertilizer in the brain. And it allows our neurons, our brain cells, to communicate with each other more efficiently, which allows for optimal expression of serotonin, dopamine, norepinephrine, these chemicals that are so important for mental health.
Okay. So movement helps that.
Yes.
And what about sleep?
Mm-hmm.
Right. How important is that for our mental health, and why?
I mean, it's critically important. I'll tell you, so many of my patients, and the thing to keep in mind, Christine, is like sleep and mental health, particularly, I would say most mental illnesses, but particularly when it comes to depression, have somewhat of a bidirectional relationship. Meaning if someone is not getting quality sleep, right, then they're increasing their risk for waking up every day feeling sluggish and tired and experiencing brain fog, which could then lead to this overall experience of feeling depressed. But the other way, applies too. So if someone is experiencing depression, then studies have shown that depressed patients have a harder time getting into N3, slow wave, deep sleep. So even if they're spending 10 hours a night in bed, they're going to wake up feeling like they haven't slept very much.
Right. I've been told when people are worried about something, and they wake up at 3 a.m. and their mind is like racing.
Right.
You have any suggestions for the racing mind?
Well, I'll tell you. I mean, it's something I'm familiar with personally, right?
Mm-hmm.
So I think most of us at some point in our life, if we're worried about something, or if we've endured depression before, as I have, I mean, we know what it's like to wake up in the middle of the night. Now, there's some things that we can do, right? The first thing, obviously, is if you're experiencing severe depression or severe symptoms, meeting with the therapist, meeting with the psychiatrist, because sometimes treating the depression can help with sleep, even if you're not specifically giving a medication or a strategy to help someone sleep better. But some things that everyone can do at home is, pay attention to screen time. Now, the science behind this is that green and blue wavelengths of light that are emitted from our smartphones and tablets and computers and televisions actually make it more difficult for melatonin to be released in the brain, which is important for telling us that it's time to sleep. Okay. And then there are other strategies in the book, but the second thing I'll just highlight here is that, and this is something that is a surprise to a lot of people, but most evidence suggests that the ideal temperature for our bedroom should be on the colder side. So most of us are sleeping in bedrooms that are way too hot. So you want to keep that between 65 and 70 degrees, ideally, especially if you're having trouble getting restorative sleep.
Okay. Well, I really appreciate that note. I'll have to mention that to my husband.
Yes.
And
that's usually the barrier. We have the spouse who wants a little bit warmer, so
yes.
You can convince him with science.
Okay. All right. So can we end with a little bit of your story, your journey, how you even became a psychiatrist? I understand that you were quite a talented musician.
In my past life, I was. So I'm
still.
Yeah. I'm turning 40 in a couple of weeks here. So I'm about to have a big birthday, but I'll tell you,
you're a baby. That's what my mother is 98 years old, and she tells me I'm a baby still. So.
I feel like an old baby, but I'll take it. I'll tell you, two decades ago, when I was in my early 20s, I struggled with depression, and at that time, I was really struggling to find out what I wanted to do with my life. I spent 2.5 years at Juilliard. I was an oboist. I ended up transferring down to Houston, went to Rice University, and really around that time started the long road to becoming a doctor. And I would say depression is probably one of the reasons, even though I didn't know it at the time, probably one of the reasons why I felt the way I did up in New York and wanted to come home to Houston, where I grew up. And I'll tell you, Christine, around that time in my life, I had a really difficult time feeling comfortable connecting with a psychiatrist or a therapist. I went to therapy at one point. I remember actually walking out during one of those visits. I was just turned off by how corporate and stale the experience felt. The person had a clipboard and was going through a checklist. And so I really had a difficult time communicating what I was feeling to professionals who, looking back, probably could have helped me. But I did happen, thankfully, to discover yoga at the time through a Groupon. And I didn't know at the time that it was evidence-based. I didn't know that it could help reduce anxiety or make me feel better. But what I did notice is that every time I went, and the more I went, it's like a cloud was lifted just a little bit, and I felt better. And so I would say that during that time, yoga played a huge role in my life. And, as I ultimately went through medical school, psychiatry residency training, and later got a fellowship in integrative medicine, I started to learn how strategies like the ones I talk about in the book, sleep, spirituality, nutrition, breath work, and movement, can be recommended alongside medications and talk therapies to really help people who are enduring depression, anxiety, and other mental illnesses live their best life.
Okay. All right. Well, fascinating. So we will be stronger people, reaching out to our spiritual foundation.
Yes.
I personally find comfort in in some of the promises in the Bible and in music, and hearing a good sermon too. So I thank you so much, Dr. Gregory Brown. Any last words before we sign off?
I'm happy that we're doing this. I'm so passionate about mental health. I think most of us are thinking about mental health, but we're still not talking about it enough. So if you are moved and inspired by something that you heard today, I just encourage you to keep the conversation going with your family and your friends.
Thank you so much.
Thank you.
Bye. So Dr. Brown's journey back from depression started with a Groupon coupon for yoga. You never know where your help will come from. God is good. So friends, keep moving. Remember the deep breathing 4-7-8 technique for anxiety. See attached reference in the podcast introduction. Stay connected and get help if you need it. Until next time, this is Dr. Christine Ince wishing you a balanced and healthy mind, body, and soul. Please like, share, and comment.